The inflammatory response. Acute inflammation. Acute inflammation is the immediate and early reaction of the microcirculation to metabolically altered cells, foreign particles, microorganisms, or antigens. Inflammation includes fluid and white blood cells movement from intravascular to extravascular compartments, and it aims at localizing and eliminating obnoxious substances. Acute inflammation may end by resolution, fibrosis, or progression. Acute inflammation may resolve, where the immune system overcomes inflammatory stimulus with restoration of histological and functional integrity. Or fibrosis may occur following extensive tissue destruction. Also, acute inflammation may progress to subacute intermediate inflammation or chronic proliferative inflammation, which may be non-granulomatous or granulomatous. Chronic inflammation. In chronic inflammation, there is infiltration with mononuclear chronic inflammatory cells, including macrophages, lymphocytes, and plasma cells. There is tissue destruction, which is largely by inflammatory cells, and repair involves angiogenesis and fibrosis. Chronic inflammation may follow acute inflammation, or it may be as a result of viral infection or low virulent persistent infection, which induces a granulomatous reaction by Mycobacterium tuberculosis, Mycobacterium leprae, or fungi. Chronic inflammation may also be as a result of chronic toxic agent exposure, as in silica granuloma, or an autoimmune disorder, as rheumatoid arthritis. Chronic inflammation may be non-granulomatous or granulomatous. In non-granulomatous chronic inflammation, there is an inflammatory infiltrate composed of lymphocytes and plasma cells. It usually denotes activation of the immune system, as in endogenous iridocyclitis and chronic endophthalmitis. Occasionally, lymphocytes and plasma cells may present the acute response to certain viruses. Whereas in granulomatous chronic inflammation, there is an infiltrate which contains epithelioid cells and giant cells. It represents a response to large quantities of insoluble antigens or organisms that grow intracellularly. Granulomatous chronic inflammation may be due to bacterial or fungal agents, or inorganic metals or dusts. It also may be as a result of foreign bodies or unknown etiology. The bacterial agents include Mycobacterium tuberculosis, Mycobacterium leprae, Treponema pallidum, or Bartonella hanseli, or the so-called cat scratch disease. An example of the fungal agents is Histoplasma capsulatum, ocular histoplasmosis. Inorganic metals or dusts include silica granuloma. Foreign bodies also include suture granuloma or endogenous sources, as lipid inchalazion, cholesterolosis, and keratin in ruptured dermoid cyst. The etiology may also be unknown, as in sarcoidosis. Granulomatous iridocyclitis shows large, greasy, mutton fat keratic precipitates on the back of the cornea. There are different patterns of granulomatous chronic inflammation, including the diffuse pattern, the zonal pattern, or the granulation tissue pattern. In the diffuse pattern, there are ill-defined borders with epithelioid cells and giant cells, randomly distributed against a background of lymphocytes and plasma cells, the so-called salt and pepper pattern. This may be due to sympathetic uveitis, juvenile xanthogranuloma, Vogt-Koenig-Harada syndrome, toxoplasmosis, tuberculosis, or leprosy. There may also be discrete nodule or aggregates of epithelioid cells surrounded by a rim of lymphocytes. This may be caused by sarcoidosis, miliary tuberculosis, or tuberculoid leprosy. Another pattern is the zonal pattern, where there is palisade of epithelioid giant cells around the central antigenic nidus. There are concentric zones of lymphocytes and plasma cells surrounding the center. This is due to phacoanaphylactic endophthalmitis or rheumatoid scleritis. The granulation tissue pattern is seen in reparative phase of chronic inflammation. It is composed of lymphocytes, plasma cells, macrophages, proliferating capillaries, and myofibroblasts. There is pyogenic granuloma representing an exuberant proliferation form. It is to be noted that granulation tissue name comes from the granular appearance of healing wounds noted in the pre-microscopic era and is not granulomatous.